Amen.
All right, folks, we're ready to get started. We're live at 6. We're ready to get started. Don't come on at 6. We're ready to get started.
Ready to look? I keep saying I'm like, what's up, Hopper? Good to see you.
Good evening. Good to see everybody this evening. Welcome to tonight's forum and discussion on a potential new project, exciting project here for Harris County. My name is John Aswell. I work for Blue Power Company. I support community and economic development in the West Georgia region. I also have the honor of serving with the steering committee on healthcare training, working with Mercer University and different stakeholders. We thank you for coming out tonight for this presentation. This is the third in a series of presentations held in late September. We launched our first forum with approximately 25 to 30 regional healthcare representatives. We wanted to share with them the vision of this project, potential of this project, and also get feedback and questions and guidance from that group. It was a well-attended meeting that approached our forums. We learned a lot from that meeting. Later on, earlier today, we had the opportunity to meet the institutional leaders of Harris County, state representative, legislative, education, and commissioner representatives to talk about also to share with them this project and also get their feedback and their guidance on this project. And again, tonight, this is a final of a public forum that we're doing to get out also through social networks. So we are being live tonight, as well. And we appreciate you tuning in. But that's what as we start on tonight, we've got a couple things here. First, I want to introduce you to our guests tonight, so we get familiar with them. First, we have Dr. Gene Sumner. Dr. Sumner is the Dean of Mercer University School of Medicine. We also have Mr. Ben West. Mr. West is Executive Director of Finance and Administration at Mercer University. Our agenda tonight is pretty straightforward. What we'd like to do is share with you where we've been as a steering committee first, who the steering committee is on this idea, bring it to where we are today and the work that's been done. And Dr. Sumner is going to come up and speak to you, give you a little bit more in depth about Mercer University School of Medicine This mission particularly focuses on rural healthcare, as well as this opportunity for a primary healthcare clinic in Harris County. After that part of the presentation, we're glad to take your questions. If anyone has any questions or thoughts or any feedback that you'd like to give us about the potential of this primary healthcare clinic. And from there, we'll share with you our next steps, and what next steps we have, and then we'll adjourn. So with that, without any further ado, I'll turn it over to Morgan Marlowe, a chair of our steering committee. And forgive me, I did introduce Morgan as a coordinator of development of the Harris County School Systems and a chair of our steering committee. Thank you.
Good evening. About a year ago, Roger Couch, the superintendent, asked me to look into, or a group of us to look into providing school-based clinics in Harris County. And I didn't really understand what that meant, and I'm not sure that I still understand exactly what that will mean in Harris County. But we set off on that mission. We had a couple of meetings, and a friend of mine, Chance Carlisle, and I went down to Mercer Med in Columbus, and we visited with Lance Carter down there because he was going into Fox Elementary. And I was trying to figure out what that relationship was and how that worked out. Through a series of events, I ended up speaking with Dr. Elder, who's the pastor of First Baptist Church in Columbus. Just talking to him about Mercy Med and the mission and what we were looking at doing. And he said, you know, this sounds exactly like Mercer University's mission when they educate doctors. So he set up a meeting. We had a meeting with several of them. I don't remember. They had a whole room of them. About 7 of them came from Mercer to visit with us. And we went through and we talked through the process. Miss Shalia Baker and I went down to Plains and we visited that clinic, which was the first one that they opened, and we liked what we saw. We set out on a journey to see how we could bring martial medicine here. We created a steering committee, so I had John Aslett with George Powell, Kim Thorpe with the Chamber, Becky Langston with the Board of Commissioners, Julie Brown with the City of Hamilton, Craig Greenhall with the Development Authority, Shalia Baker and Justin Finney with the school system, and Kathy Carlisle with Focus. We all met, and there was a representative from Mercer. We met weekly for a while, just working through the steps, through the process, what we could do, where we could put it, how this looked. And we decided that the best facility in Harris County was the old library on College Street in downtown Hamilton. If you look out from that front porch, you see a pharmacy, you see a dentist, Focus, you have the extension office, you've got DFACS, and you've got a courthouse. It just creates a nice little hub of services right there. It just seemed to fit. So we started that conversation with the county on what that would look like, how we could put them in there. And hopefully this week we will finalize an MOU between the 3 parties, the school system, the Board of Commissioners, and Mercer. The school system has agreed to provide some storage space. I don't have a number, but it's going to be somewhere between 3,000 and 5,000 storage space for the county. The county is going to do some renovations to the library. This SPLOST funds are going to redo the roof and the HVAC, and then Mercer is going to lease it and provide the services. So it's a public-private partnership. This is how they should look, in our opinion. We've gone through the process. We've tried to be as inclusive as we have. Everything I've heard from Mercer, from the first time we went down to Plains, has been, if we ask for it, they can do it. I'm going to let Dr. Sumner give their history and their mission and what they do, but it fits perfectly with Harris County, in my opinion, and with the steering committee's opinion on what we're looking for in terms of the dual clinic, healthcare clinic, which for a county of 35,000, I have $1 office in the North Plaza is unacceptable. So hopefully we can bring about that change. Were you going to speak next? So I'm going to let Dr. Sumner come up and explain, or tell you a little bit about her history and Mercer's history and how they got into the clinic business.
Thank you. I haven't been on the state of position in a long time. I want to say first that Mercer is honored by the interest in Harris County and the clinic. We take the invitation we've had very seriously. And I can assure you that we're very committed to bringing the best quality of care that we can in Harris County. Mercer 200 years. The medical school was started really in the late 70s. First class entered in 1982. And we are, though we are Baptist Heritage University, the medical school is a public-private partnership with the state of Georgia. We're state funded. And we're state funded for one reason, and that is our mission, rural and underserved Georgia. What makes us unique with other medical schools in this state is we only accept Georgians. And we do that because we know they're more likely to stay in our state. We have lots of young people who are very bright who live in Texas and California and New York. And typically, young people will apply to multiple medical schools. So I get lots of unkind letters from Texas about children who are very bright, but we don't give them an application because we only accept Georgians and we look at their roots in Georgia. A few years back, we looked at seriously our mission and how we could enhance it. And 80% of Georgia lives in the metropolitan area. And so consequently, most of our applications came from that 10, 11 county area. But those young people don't end up in Harris County or Ohio or Wrightsville or anywhere else. They stay sort of in this urban area. We're looking for young people who are really interested in our mission. We know who's qualified. We can look at their college transcripts. We can look at their medical college admission test. We can look at their work history. We can look at their determination to come to medical school and know they have the ability to do the work. So once we decide they're qualified, we take away that and we rank by where they're from. So we rank essentially by zip code. So a young person from Harris County has a much higher rate of getting in at Mercer than a young person from Buckhead in Atlanta. It's not that young person is not qualified. They are qualified. There are lots of schools that are really looking for them. Medical school is really competitive. Admissions get in, you think a 399 is better than 398. It's not. And there's so many other factors that go into being a quality doctor. But we do know that young people who grew up in a rural area are much more likely to return to that area or one similar to it. And so consequently, we lead the nation in percentage of our graduates who return to a rural area or underserved area. And we lead the nation in percentage of our graduates who return to their home state to practice. We take our mission very, very seriously. Several years ago, and I've been at Mercer now, I actually was in the first class. So I went to medical school, and I come from a family of physicians who practiced in Washington County and San Antonio. And I married my husband and moved to Johnson County, and there was no health care there. And I had gone to graduate school, I went to nursing school, got a master's, and got my prerequisites for medical school. And I thought, well, I'm going to apply and go to medical school at Mercer. And so they were kind enough to let me in, and I went back home to Johnson County and was the only doctor there for several years. And so I've always been grateful for Mercer for giving me that opportunity to go back home. And I don't think there's a better job on earth than to be in a rural community. And I don't think better medicine is practiced anywhere else. Because in this country, we've been led to believe that a specialist is a higher quality of care and we need specialists. But what's wrong with our healthcare system is we don't have primary care doctors anymore. We don't have doctors that see you and know you and examine you and are your doctor and answer their phone on Sunday afternoon. And help, call the surgeon in Atlanta that's about to operate on you and give them a piece of their mind about who, that you're my patient. We need that. We need somebody that cares about you and that can work in partnership with you. One of the things that we look at seriously is health status across Georgia. And West Georgia is generally, Harris County has a better health status than some, but West Georgia has a very poor health status. So consequently, we were asked by Columbus to come to Columbus about 6 or 8 years ago, and we have a 2-year campus. We have a 3rd and 4th year campus in Columbus. And next fall, we will open the first 2 years, 1st and 2nd years. We'll have a 4-year medical school campus in Columbus. It's just like our campus in Macon and just like our campus in Savannah. We have looked seriously at attracting young people from West Georgia who will go to that campus or can go to any campus. But we want them to come back to West Georgia. So our applications from this area have increased dramatically. And we've increased our admissions from West Georgia by, I think, 165%. I think I said 155%. So our number of students who've applied to come to the right now 480 medical students. We will add another 240. So we'll be one of the largest medical schools in the country, actually, when we finish ramping that number up. But all those students will be from Georgia, and preferentially they'll be from rural areas. The entering class last year was 70% outside metropolitan Atlanta. Now, we always have students from Atlanta and the metropolitan area, but we put a lot of emphasis on those young people going back to the urban areas and serving underserved populations as well. We really want them to come to places like Harris County. But one thing I think those of you who are in education know, this is a little different generation. They have their strengths and weaknesses, but they don't know a lot about business. And as we were thinking about how to encourage that, we came up with a model of clinics. As I said at lunch today, we had this model of rural clinics. I practiced most of my life in Washington County and Johnson County. And I really believe that a physician can be successful in this area. If you practice good medicine and you care about people and your community responsive, you will make a reasonable income or a good income no matter where you are. And so we take that seriously. We came up with a model of rural clinics. And one thing we know is that every community is different and every community has strengths and weaknesses. So one thing we don't want to do is ever come into a community and say, this is what you need. We don't know. We have to learn about your community. We want to get to know you. We want to be part of this community. We want to build on the strengths that are already here. We don't want to replace anybody. We value anybody that contributes. We want to be your partner. Mercer is of course, a private university, and the money we invest in a clinic is Mercer money. It is not state money. And we're tightly managed, and we will tell you that. We run a tight ship. We like to say we're the best money the state ever spent. But we don't spend state money on a clinic. And when we start that clinic, one commitment we make is we're here. We're going to be in Harris County. We're not going out. We're not part-time. We try to hire local people. We try to hire local physicians or physicians that are from this area. We hire additional staff. We tend to use local contractors. If we refurbish a building, we use, that's what we did in Plains, we use local contractors, local planners, local things that we can use that. We partner with local pharmacists and local dentists and people like that, because we don't want to bring in outside services unless you need those outside services. We want to be part of Harris County. In Plains, the way we got to Plains, we had the model, and President Carter, who was the trustee at Mercer, called President Underwood, our president. We talked to him a little about this idea we have a clinic. Because we have all these students graduating, and they're gobbled up by hospital systems. And hospital systems need good doctors. But healthcare transitions to the community, and length of stay is fine. It's just short. And as I said this morning when I was in nursing school, you stayed 10 days for a gallbladder surgery. Now you stay 10 minutes, and you probably stay 2 hours, but you don't stay long. My administrative assistant's husband had a knee replacement. It literally was in the hospital 4 hours. Heart surgery used to be weeks. It's a few days. And who takes care of those people in the community? You don't want to get your primary care at an urgent care or an emergency room. And as we age, you need care in the community that cares about older people. Good health care certainly influences educational outcomes. And having a physician in the community is a $2.3 million industry. I hate to talk money, but that's what it brings. It brings jobs, it brings resources. It helps people think, well, they have health care, I'll relocate them. Mercer's committed to that. But President Carter lost the doctor in Plains. Plains lost the doctor. Plains has about 400 plus people who live in the city. President Carter called me and said to President Underwood, I have this wonderful little building that will rent you to put a clinic in. And so when President Underwood didn't call back in a week or so, President Carter called back and said, where's my doctor? So he sent me and a team from Mercer to Plains. And this wonderful little building was concrete block, and it really looked like a concession stand at the Johnson County High School of football. And hope you'll see that Mercer is very particular about the way we build a clinic. We want it to look really nice. We want anybody to feel comfortable coming there, but we take everybody that comes to our door. We never turn anybody down. We're serious about service, and that's who Mercer is. So we went down to Plains, and in about 6 weeks, we refurbished that green building, and it's much nicer. We brought in X-ray, which they'd never had. We brought in lab. We brought in telehealth. Had a little discussion with the congressman today at lunch. Telehealth is more than a video chat. You can actually listen to heart and lungs, looking at ears, nose, and throat to a patient if they're sitting in the unit anywhere. And there are devices that will soon be on the market that cost. In fact, Mercer helped a cardiologist to develop a cell phone stethoscope. And that stethoscope, I have a $450 Bluetooth Littman cardiology scope. They took that device and Mercer Engineering made it as the sound engineers compared them, and they were identical, and it cost $11 to manufacture. So you could put it on your cell phone, and the doctor on the telehealth unit or the video could actually hear your heart effectively or listen to your lung. So telehealth is rapidly changing, but we believe in quality telehealth, and it should not replace your doctor. Your doctor should use that so that if he checks your ear and you're at home, you should be able to tie into your doctor for a follow-up appointment. If you have a pacemaker and the doctor just needs to look at your stitches, telehealth is a great way to do that. So those things should enhance the services. It is also a way to bring in mental health services and to bring in specialty consultation. And we do that some in our other clinics where you can see the doctor preoperatively, go have your surgery and then follow up locally. And those things work very effectively. But, so we went ahead, opened the Plains Clinic, hired a local doctor, hired a nurse practitioner, hired staff from the area, put in all these additional services, and before we opened our doors, we were booked for 3 months, which was a problem because we believe that you should have same-day appointments and walk-in appointments. And if you're sick, I have children and grandchildren that live in Atlanta, and they'll say, "Mom, I called my doctor, but he can't see me for 10 days." And I'm going, "Good gracious, wow." And so if you have a bad throat, you have a fever, I don't want you ending up in the emergency. Mercer doesn't need to have a clinic here. We want to be available to you. So we backed off, and really we've been successful. And I think somebody told me a few months ago we've grown from about 10 counties now to Plains. So we're busy. We opened our second clinic in Fort Valley. We're going to open our third clinic in Clay County, which is Fort Gaines, south of here. Clay County, if you know anything about Clay County, has really no care. It's a beautiful county. It has a state park in Chattahoochee. It's really a place that I think we're doing quality health care. But we took the old hospital and refurbished one wing. We put public health in the other wing. I'd love to see DFACs in the same place, but we're doing some creative things right now. Mercer does not ask for any support once we open. We feel like we can be sustainable, and that's sort of quality control. With Plains, as I said at lunch, President Carter's our quality control, because he'll hear something at church that didn't go just right, and he'll call us and tell us, and so we follow up. But we want to work with a community that holds us accountable. And like we mentioned, we have an advisory board. We really want to know what we do right, what we do wrong, how can we help, what services do you need. We'll send in our public health and community medicine people and do a comprehensive community needs assessment and build on the strengths here in Harris County. Mercer cares very much about rural Georgia, and we're here to stay and are glad to be partners with you in this endeavor.
Thank you, Dr. Summer. So that's a little bit about Mercer and their services and their intentions of coming to partner with us here in Harris County. We'd like to take a few moments now if any of you have any questions about the clinic or healthcare in general for Harris County or this region. We'd love to take them, or any thoughts that you might have. We did have one come in earlier through technology. Didn't you have that? Wait, that was back.
The question I asked previously was, will there be employment opportunities for locals. You addressed that a little bit, but can you address a little bit what you think the staffing will look like?
Yeah, I'll be glad to answer that. Typically in these clinics, we'll have a physician, a nurse practitioner, 3 or 4 clinical staff under them, and a medical receptionist. And what we'll do is try to find a physician that is local to Harris County or close, and we'll hire the rest of the staff from Harris County if they're qualified. So in most of our clinics, we have been able to hire local people, and those people will be employees of Mercer University. Get the same benefits that I get, which I tell people all the time, that the healthcare aspect of what we're doing changes people's lives in these rural communities. But what a lot of people don't think about, and what I try to remind them is, if you've got a single mom with 2 kids in Harris County that comes and works for us in this clinic, that mother can send those 2 kids to Mercer University and get a 4-year bachelor's degree with no tuition charged to her. And that changes that family's lives and those kids' lives. So it's a very important aspect of what we bring to these communities, of those benefits as a Mercer employee. Questions about that, and any other questions I can answer? Yes, ma'am. Our main physician will be an MD boarded in either family medicine or internal medicine, but we will have our students rotating through that clinic to get some experience. Yes, ma'am. Okay. Yes.
What will be the relationship between the clinic and the medical school in Columbus and family medicine residency program?
Yes, our students go through the family medicine residency at Piedmont Columbus Regional. So some of those may be rotating through this clinic during their family medicine rotation.
Medical students, we're accredited by the LCU, the Electronic Community Medical Education, it's extremely high standard. Our students would never be able to learn the practice, and they have to be supervised always, and they would never see a patient that wants a community to see that patient. But we find great value in our students seeing community responsive, engaged, well-qualified physicians practicing in the area. So they don't think about that if they spend all their time in the hospital. The sad thing about medical education is we're still using a model that was developed at Johns Hopkins in the late 1800s. We still train doctors the same way. And that model has to change. Education has changed. So we want to get them out here to see what they can, what that difference they can make in this community. Not only that, it's a great job. So
Yeah, the services that will be in this clinic, again, we'll have a primary care physician that will provide those services. I'm meeting with some hospital representatives next week in the Columbus Hospital for the end of this week to talk about working with them to provide other services like women's services and psychiatry services and those types of other services. And we will have an x-ray machine in there. Again, we'll have telehealth. We've got marriage and family therapy professionals that can provide services through that telehealth. So be a broad spectrum of services. Yes, ma'am. That's correct.
So the question was whether any of this would fall back on Harris County residents, in the form of increased taxes? The answer to that is no. The steering committee has agreed to raise $600,000 to renovate the building. The county will spend the money to do the roof and the HVAC, and then once we turn it over to Mercer, Mercer takes care of everything else, and they will lease it from the county.
Yeah, for residents without insurance, we see all patients, no matter their ability to pay. And we will have a sliding fee schedule for those that are uninsured or underinsured. We'll see anybody that walks through the door.
Georgia is, you may know, is out of 50 states, we're last in the nation in maternal mortality. Women die having babies in this state because they don't have access to care. And when you first think about that, you think, well, that's because of hospital care, but it's actually not. It's because of the lack of community-based care and what's called health literacy. So you're a new mother, or expectant mother, and you start bleeding, and you don't have anybody to call because you go to a clinic 80 miles away and nobody answers the phone and nobody tells you what to do. And, you know, I said today at lunch, when I had children, I had 2 grandmothers and a mother and a father who was about, and somebody you could ask, you know, but the families so often don't have that now. So bringing women's services, we are committed to women's services in every clinic. We hired an OBGYN in Plains. The doctor in Fort Valley provides those things. We'll partner with, we'll partner with a doctor who may want to come here 3 days a week and do routine GYN care. One thing that we overlook is pregnancy preparation, good nutrition, weight loss, exercise, making sure that you're ready to get pregnant, and also pregnancy care. And most pregnancy care is basic. Now, I'm an internist, and I really enjoy obstetrics. I never did that, but in my time in Johnson County, I delivered 14 babies because the police would pick up women in labor, and there was no hospital, so they'd bring them to my house or my office. And I used to think, well, if I wasn't healed, I'm better than nobody. All of them would come. But really, it's about having a health coach, having a physician who cares about you and can give you advice and connect you to the right people to get you through that pregnancy. And so we're very committed to that. We want to change that dynamic. The health literacy and health, and by that I mean, I'll give you an example, unrelated if you will. On the way up here, I've been at Mercer 5 years and left my practice to come to Mercer. But I had a young woman whose daughter was a student at the University of Georgia. And this young woman has had problems for 3 years. And as a young teenager, I saw her, but I haven't seen her for years. But I knew the mother, and the mother is not a complainer. And the child was never a complainer. She was having terrible problems with her leg. Nobody could figure it out, and people told her she was probably crazy and complaining, and they just dismissed it. And this had gone on for about 2 years. So the child had gotten a position, but she was afraid to take it because when she graduated, she was going to have to go overseas. And the mother called me, and I said, years ago I had this particular case, and it was this diagnosis. I have no idea what you have, but when you go in, ask these questions. Just ask these questions. But she went to a vascular person in Atlanta, and she said, I don't mean to be rude, but I want to ask these questions. And the doctor was dismissive. But he said, I respect the fact that you've looked something up, so I'm going to do the test, even though she doesn't need it. So she got her leg fixed today. She had a very rare arterial occlusion of her leg that was uncommon, and I've only seen once in my life. But health literacy gave that mother the ability to ask the questions to get the right test done. And so it's important to have that advocacy. We work really hard to educate patients, or to have advocacy on their behalf if they can't do it. So I think bringing that to a community is important. Doesn't mean that you don't already have a lot, but there are a lot of people that don't have
I need to clarify one point to your question. The money that the county has put forward is SPOS money that was already designated for renovation to that old library.
Any other questions?
You know, some of the first of all, thank you. And, this is a member of the community, I think I can speak for me and tell you how excited you are to have you here. My family has been around about 6 years now. And, I think we have all felt the burden of the action of what we do. And we're really excited about what, our community is doing, about the community coming back down. I was just curious, you said that when you opened, I think the one in front of you kind of immediately hit saturation. What has been the trajectory of the clinics that you've done so far? And have y'all seen yourself adding staff to accommodate the needs in those towns?
You know, currently we have two that are operating, the one in Plains, and we did have to increase staff down there when we brought on the women services provider. We increased by one clinical staff person to handle that load. In Fort Valley, we actually took over the practice from the existing physician, and he already provided all the services that we would have provided, and he had the staff. We brought on him and all his staff. So if there's a need to add staff, we will always do that to provide top quality care.
What can people like myself, and probably a lot of the citizens in this community, we're not looking for any official sort of way, but what can we do to help build goodwill and maybe these guys can make that happen?
I want to tell you from my experience, having practiced in Wrightsville, one of the poorest counties in the state, and I came from a family of physicians who have been in Washington for 200 years. Had I not married somebody from Johnson County, nobody in their right mind would have opened a clinic there. But, you know, I was optimistic that we could do that. I think what you can do, whenever people would show up and say, I'm here to help you, you weren't so sure they really were. You know, I say this with kindness, so please don't think it's disparaging. I come from a family that all went to Emory, so I love Emory, it's a great place. But Emory would get a grant, and they would show up in Wrightsville and say, Gene, we want to work with you. But the minute the money was gone, they were gone. And you really get an attitude because your patients would enroll in this great trial and they'd have everything they needed, and the grant would run out and it's cut off and you couldn't fix it. So would they come after that, or anybody, and say, nope, you know, it's just not fair to patients. So what we say and we mean is, once we're here and open and get our staff in place, it's on us, and we're going to be here. But you practice good medicine, you treat people with respect and dignity, you will be busy. But what you can do, because strangers in the rural community remain strangers unless you know somebody that knows somebody. So just say, you know, one of the hard things for young doctors particularly is you have a patient and grandma gets sick and you take care of grandma and you do everything right. But grandma passes away. The lady at the Piggly Wiggly in Wrightsville will say, you know that young doctor, he took care of grandma. But if I'd been there 20 years and said, you know, he was great and did everything right, it goes away and it supports that doctor. So we try to support those young people when they get started. But what you can do is say, I mean, I don't want you to say it until you know it, but if you know that people had a good experience, say that and help us reach out and help us find ways to serve this county in ways that are meaningful. Because if you go out and do a health fair and do things like that, you get your name out there, but it still takes some of a personal reference to get that trust. Trust in the rural community is really important. And we take that obligation very seriously. And I can tell you that Ben and his team and our clinic manager and our head nurse, they spend hours working on customer experience and making sure that front desk staff understands that we answer the phone and we say, yes, we're working in. But we also expect the physicians to honor that standard of care. And it's being said throughout the benefits, that single mother we hire also can go back to school at Mercer for free. After she worked for us, while she can get her degree through us. We encourage them to grow and to learn and to move up the chain. And we give good health insurance, good retirement, and those things.
Like in something as simple as retailing our friends, when the thing comes from Harris County, push your dollars and start
Well, I don't want to do that. But I can tell you, Friday afternoon at 4:45, when they cut their hand, and you call us and say, I got a friend who's got a laceration, can you see him? We'll say yes. And this is something my father taught me. Stay there till it's time to close, because that last guy you see on Friday afternoon will be your patient forever. And it will, see that patient, serve them, no strings attached, treat them fairly, and pretty soon they'll get tired of driving around.
Hold on, let me address it. You talk a lot about community and what we can do, and one of the commitments that they do make, Mercer has made, and I'm not kidding with everything we've asked for, they say, yeah, we can do that. They want to be a part of the community, they want to be integrated, but one of the important aspects to this whole thing is they have agreed to help us, I shouldn't say agreed, but they've offered to help us increase the number of pathways, or look at ways to increase the number of medical healthcare pathways in the school system. We've looked at opportunities for interns from Harris County High School to get in there, so that we have the same philosophy they do, but on a much smaller. We want to educate kids to come back here. We're a little bit tired of sending our best and brightest off to help some other community. We want to keep them here.
You mentioned telemedicine, and I wonder if attention is being given to the fact that there are a lot of things in the community. I was 3 miles from I couldn't do a Zoom call with my wife, and I just wonder if something being done in terms of infrastructure, or web development, so that everybody has access to that. We're trying to get ramped up.
One thing I said at lunch, that if you say anything good about COVID, the rules about telehealth have been loosened some, because care in the home is important. Being able to get an opinion from a physician is important. But when we talk about telehealth, we talk about quality telehealth and the ability to really examine that patient. Fort Gaines, honestly, I think ranks among the world's most barren broadband areas. There's no telehealth, and there's no internet service there. You can't even get cell service there. We looked at ways to help, and we reached out to a number of servers, but they even were challenged. And we found a person, AT&T services something called FirstNet, which is what EMS uses, and it's a chip you can get and put in your device that will bring emergency services, but regular people can't use that. There's a company that was in Gainesville that was doing a lot of work, the military, I understand, doing hardware and electronics. They got a device out of it, it's ready military. And it's a unique device that takes a cell signal, splits it up, enhances it, and I am not the tech person, so don't laugh at me, puts it back together. And they just got their first shipment into this country. The first unit in the country went on the Clay County building. So we have 50 megs. That doesn't make sense to get it on the road, but it's fast. So I do know. You can do telehealth with a hotspot. Hancock County, Georgia is Sparta, Georgia. If you ever done 15 to Athens, Hancock County. Hancock County is one of the poorest counties in Georgia. More federal funds, more foundation funds have been put in that county to try to eradicate poverty and move people along than any county in the nation at one point. And so we went up to Hancock County to see if we could help early, before I actually came to Mercer. Mercer had called me. We went up there and started the project. We got the first waiver for Medicaid for ambulances to use telehealth. We got a hotspot a military grade enhancer to put on the ambulance, so when the ambulance pulled up at the house, the person inside, we could take a telehealth unit in that looks like just a briefcase, connect that person to their doctor or to emergency room care, because 75% of the 911 calls in Hancock County were non-emergent, but there's no care there. So you could have that care just through that system. And before we left the house, you could get an appointment with a doctor. We made sure you followed up, and if they didn't go to that center would call them the next day and say, what's the problem? So that's how you started out. Hotspots will do it. You these Verizon hotspots or AT&T hotspots. You can do telehealth over those. You can turn your personal hotspot on your phone sometimes, but you can also do a telehealth visit over the telephone or just a check. Those things are paid for now by Medicare and most insurers. And I had the opportunity, I got involved in telehealth years ago because I thought it was a crazy idea. And as I said at lunch, I said so in a big public meeting that I was speaking at, and made a mistake. The guy stood up in the back and he considered himself the father of telehealth and said, if you'd been, I remember his words because I was giving the speech and didn't know the people, and he said, if you'd been president instead of Eisenhower, we wouldn't have 4-lane highways. And so we actually got to be friends after that, and a few days later, some telehealth people came to my office and said, let us show you what we can do. And we did telehealth in Wrightsville, Georgia. It was amazing. And we did a lot of mental health. We did cardiac clinics there in the office. But when a person needs to see a psychiatrist or a mental health provider, they could come in my office. It was on time. It was extremely high quality. But the one requirement I had of the psychiatrist we used was my patient can call you in an emergency. So at 8 o'clock at night, if the medicine was not working or they were having a reaction, that psychiatrist would answer their phone. And not only that psychiatrist knew where the emergency facilities were. And I'll tell you, if you don't, I'm not going to label this, I'm going to tell you one more story. I have a partner who still practices in Sandusville. We had 2 offices. And he had a young woman who he had seen for a while, and she came in to see him, and he knew something was wrong. He was an internist like me, and he was trying to find a psychiatric facility. And we literally called every psychiatric facility in Europe in the state of Georgia, and we got the same answer. We don't have any beds, we don't have any room, we'll see her in the night. And everybody said, send her to the ER. And both of us thought, well, if you send her to the ER, they're going to give her a shot of Powerball or something and send her back home. And she didn't need to go to the ER. She had a mental health crisis. And so he called me and said, do you think you could get an appointment to see her with one of the telehealth psychiatrists? But I don't know, I'll try. So we got one of those guys to see her on his lunch break. I was busy seeing patients. I did not know this patient. But I saw the nurse put her in the telehealth room. And so as I was seeing, I thought that some policemen came to the front door. And I thought, oh my gosh, what happened? And then the ambulance backed up to the back door. And this psychiatrist had gotten her to tell him about a plan to kill her family that night. And she had the shotguns and all the guns in the car. And she was going to kill them, her husband, her children, and commit suicide. They were able to get her admitted. The psychiatrist called the facility and said, if you don't have a bed, make one. This person's coming. She spent about 2 weeks in the facility. That lady is fine. I see her in the grocery store. She didn't know I even remember. It's been years. Her family's fine. They're happy. It was just a crisis. But that telehealth visit saved her life. And if you can bring mental health care into these communities that's quality and available, you'll change lives. Because mental health is important as physical health. It actually impacts physical health, obviously, but it's really important to have quality services. And we're in a desperate shortage here. We're working right now with St. Francis, the Bradley Center, the Pastoral Institute, the state of Georgia, and I hope the military base, because they have some resources in Columbus to start a site residency in Columbus that has potential to be a really big residency. Quality telehealth matters. And you're right. Broadband is lacking, but I do think the state realizes that, and there are a lot of new technologies. pardon my, the, you know, I guess I'm old school, it infuriates me when that happens, that you can't access care, you know, and truthfully, it shouldn't be that way. What we can do is have a doctor who gets on the phone and advocates for you. It amazes me that people go to the doctor and they go, and I was in the grocery store at Piggly Wiggly in Wrightsville, Georgia. One of my former patients came up to me in the vegetable section and said, Dr. Sumner, I had this major GI bleed, and they gave me a list of GI doctors and told me to make an appointment. And I've called them all, and it'll be 6 months before they can see me. That's unacceptable. So our doctors facilitate appointments, and we also have I don't know you don't want to go to Macon, but we do have a faculty practice in Macon. But we know a lot of doctors, and there are a lot of Mercer grads in this area. And it wouldn't get to me because I have a great opinion running Mercer medicine, but if it got to me, I'll call them up for it. You know, that's just not the way you should do it. And I think it is a problem. And as physicians, we own that. It's terrible. I don't like it. But I hope we change it. And I do think the state of Georgia is working really hard to change the rules, because the rules were made that benefit insurance companies or benefit people, you know, prior approvals and credentialing and all you have to go through. It used to be that I could pick up the phone and send you to somebody that would take care of you. And that doctor knew that if he gave me a prompt appointment and took care of my patient, that I'd send him another patient. But if you didn't, I wasn't going to. Now you just say, pick somebody off your list. And that's not necessarily good, because you want to, my obligation is to send you to the best person I can find to take care of you. If it wasn't urgent, you know, like my husband needs cataract surgery, he's been waiting 3 months, and I could have called his ophthalmologist, but I hadn't. You know, that's not even wait. He's not anxious to have it. But if it's urgent, we're going to help you get there urgently. I mean, our clinics will never do that. I promise you. And if they do, I'd like to know about it. So you can be my quality control. Okay.
I want to address a couple more issues. They have emphasized quality over quantity, and I hope that comes across. You know, they leave spaces open for people to have walk-in appointments. They believe you should be able to see that, see your doctor that same day. A couple of things blew me away when I went down there. They talked about on the first week they were down there, they actually had to make a house call, which is unheard of these days, because there was a diabetic in Plains, if I'm telling the story right, that could not go, and he would not have made it. How much longer? Not long at all if they had not made that house call. So they emphasize quality over quantity. The other thing is to show you the impact it can have on a community. They went into Plains thinking they were serving a community of 700 people. In 18 months, they had seen 2,000 unique patients. Something like that. So you think you're going to serve one community, and it's just expanded. It's exploded. So to see 2,000 unique patients in a community of 700 is unbelievable. So any given day during the week, and people don't think in terms like this. Harris County has 35,000 residents, but on any given weekday, there's over 3,000 students in Hamilton between an elementary school, a middle school, and a high school. So that's a large number. And then you add the teachers, the administrators, the county employees, the bus drivers. So you're basically turning Hamilton into a small college town every day. There's no quality health care. You have to go 30 miles outside, 30 minutes, 40 minutes, either way, north or south. So that would be a big impact.
Any other questions, thoughts? All right.
We do. I'm going to talk to that in just a second, a little bit of a full description and our next steps. But right now, we're not under any significant pressure other than a sense of urgency to get this done. We're hoping as early as spring of next year, very latest October. We've got about a 3 to 4 month construction renovation period that we're talking about, and that'll take up the bulk of it. But anywhere between late spring, early fall is our time right now. We'll find that a little bit here once we hire a general contractor. And that leads to our next steps. Great question, thank you. Before we go to the next steps, any other thoughts or questions or advice for us? Okay, all right. Well, let me talk to you about a few next steps that we have in order to get this accomplished. Morgan mentioned we recently, the different stakeholders came together and we defined the commitments of each of the key stakeholders, the school system, the Mercer University School of Medicine, and also our county commission, being that this is a county commission owned, taxpayer-owned building. We have crafted that MOU, that agreement, and it will be under our signature approval here very, very shortly, hopefully within the next week or so. But we've got a good detail, we're all parties are in agreement with that, and that releases us for the next step, a very important step, and that's our fundraising. As Morgan mentioned to you, we feel very important as a community that this private-public partnership be strong, and we've agreed to take on the fundraising role of $600,000. Right now, the estimate to renovate is right around $500,000. We've had a couple of contracting crews look at it and give us that pre-bid estimate. So that's what we're looking to raise $600 or $600,000, and we'll start that this week. One of the first things that we'll be looking for is Mercer's working with us. The Mercer Foundation has agreed to process the donations. So they'll receive the donations on the Mercer University Foundation webpage that will have our clinic with our name, the Harris County Clinic name on that. And people who choose to invest or donate can go there to invest. In the meantime, if someone has an interest and would like to go ahead and start investing, they can contact either Morgan Marlowe or the school system. They can contact our Chamber of Commerce, who's a stakeholder in this process as well. Call the office there, or John Asbell. I'd be glad to, with George Power Company. I'm on the record, public record there as well. But any one of us right now can start the process off of receiving. Mercer will process that. What that also gives us the ability to do is make sure that donor gets the tax benefit going to the foundation. That's a critical piece of anybody investing. So we have that. We'll be kicking that off. We hope to have our fundraising completed by January 1st. That's our hope. We should know pretty quickly. After that, or as the concurrent with that, we will also, at the first $100,000 of donation, that will enable us to go ahead and hire our general contractor. We've reached out. We're taking RFPs right now. Our Chamber of Commerce is also communicating to our members, also to the community, to let them know about this project. So if there's an interested contractor that would like to bid, they can certainly do that. They can contact the Chamber to get the specifics. But once we'll select that general contractor, and once we've raised the first $100,000, and we will begin shortly thereafter with the renovation. This is another point also, I guess, to your question about what you can do to help. Certainly fundraising. $1 is equal to 1,000 right now, or 10,000. It really is. Every dollar matters. So please spread the word. If you see the value of this and believe the benefit of this, please share, get the word out. We greatly appreciate that. Also, in the model that Mercer presented to us, there is an advisory board or advisory committee component to this. This advisory committee has the opportunity to be an ongoing, on-standing committee. There will be that liaison between Mercer University Healthcare, School of Medicine, and Healthcare Clinic, and our Board of Commissioners, and the county at large, and the Board of Education. Kind of a group to give checks and balances, to give feedback on what's working, what might need improvement. We also see this advisory committee as having the ability to also possibly be a further advocate for healthcare issues in Harris County and also in the region. If we certainly see if we get the right people in that committee, they can lend their hands and resources towards advancing healthcare in other ways as well. So we'll need committed, vested people for that advisory committee also. We're certainly, as a steering committee, looking for any recommendations that the community might have on that. So that's an immediate opportunity. Anything else as far as next steps? Yes, thank you, Morgan. Partnership. We have started out as a steering committee, as a intentional about being inclusive as possible. We reached out to regional representatives to be a part of this process. We told you about the forums that we're doing. So we've been really intent on demonstrating just a collaborative model of what we can do as a community in a region to improve the quality of life in healthcare. Mercer, as you can tell, has stepped up a big way already by who they are and what they do. They'll be a powerful partner for this community. They are a powerful partner for this community. And one of the ways, initially, they've already agreed to commit up to approximately $1 million towards starting up this clinic. That's the equipment costs, that's the personnel costs and so forth. So they're already willing to come in with that type of community. So we're really hoping as a community we can come forward with that $600,000, but we greatly appreciate that so much, that investment right up front. Laura? Good.
And we do want to emphasize the money, even though it's going through Mercer University, it is designated specifically for the Harris County Clinic here. It's not going to a fund anywhere else.
Those donations that come in, like Morgan said, they will be made out to Mercer University and specifically identified for this clinic. As far as the renovations, all that money will be tied to an enhancement fund agreement. The money can only be spent to get this clinic up and running from a renovation standpoint. So any donations made will be tax deductible and used 100% for the clinic here in Harris County.
So, if there are no other major points of interest, I'll close out by saying this. A shared vision, a shared partnership, a strong amount of collaboration from the different stakeholders. I want to highlight the county commissioners. They have really leaned into this conversation with us. Becky Langston agreed that they wanted to participate in the committee, the chair of our commission. The commissioners have been very supportive. They voted unanimously to approve the use of the facility. They've leaned into this conversation. The Chamber of Commerce has been a wonderful stakeholder in this process. Is what they do really well of convening, facilitating, pulling together, and providing platforms of communication for different stakeholders in our community. Our individuals participating on our steering committee, Kathy Carlisle as a member of the executive committee, and also Kim Basecki has come along, and Carolyn Croker has come along, and they are helping us with our marketing materials, working with Mercer University for our communications and marketing materials to go out and do the fundraising. A tremendous amount of teamwork and collaboration. Lastly, you're part of the picture. You're here tonight. We're greatly appreciative of you being here tonight and in the viewership. If you have any further questions, don't hesitate to reach out to any of us, and we greatly appreciate your support in whatever form that may come. Without any further ado, we are adjourned. Please be safe.